Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, good afternoon, or good evening to those who are watching us or listening to us today.
We have various topics today, all very interested. We give an H5N1 update and what role cows may be. And then we look for COVID-19 treatment with metformin and ivermectin. Then Melvin will present you first effective treatment found for a cobra snake bite. I will update you on COVID-19 vaccines to give you the concept again, what vaccines can and cannot accomplish. Then I report about a bacterium successfully fighting dengue in Singapore, and I will cover effect of vaccination on global survival. I just start with an H5N1 update from the United States published yesterday on the 9th of May. As you can see here, wild birds detected were almost approaching, or they were approaching 10,000. There are 50 jurisdictions in the United States with bird flu in wild birds. Among poultry, there are 90 million affected poultry animals, and states with poultry outbreaks is 48, which means basically everywhere in the United States. Dairy cattle, this is what we worry about. This afflicts 9 states and 36 herds. So that is the current situation. And now Melvin has a very interesting story to tell you on the role of dairy cattle in influenza. Melvin, what's the story?
Yes, so this is really interesting. A team in the US used archived tracheal samples from young cows and tissues collected from routine necropsy from different clinical cases at a veterinary pathology lab at the US and Denmark. And the samples included tissues from the mammary glands of a 4-year-old disease-free lactating dairy cow. The scientists found that duck and human type influenza A receptors were widely expressed in the bovine mammary gland, with chicken type influenza receptor common in the cow respiratory tract. They saw only low expression of influenza A receptors in the brain tissue samples. Basically, taken together, the authors wrote that the findings suggest a mechanism for high H5N1 loads in dairy cow milk and suggest that cattle have the potential to be a mixing vessel for novel influenza viruses. And this is really sort of different from what we've been thinking in the past, where many of the cases were mixed in pigs, right? So I think this is really interesting to see that now it seems like the cows are the more active mammal implicated in this H5N1 virus.
So is this new, or we simply have not looked for it, or we didn't detect that before, right? I mean, it probably happened all the time in history, but it's the first time that we now looked for it and we found that there is a link.
Yes, so it could be that it's the first time, or maybe in the past we really have not looked at cows, right? We were only looking at pigs. So we were focusing on pigs because of the swine flu in the past. But yeah, we don't know whether this is the first time or it's only the first time that we've seen it.
Very interesting. So I looked again in the May 9 information from CDC. To date, there are only 2 human cases. So there is no human-to-human transmission yet. But again, in the cow, there could be a mix of different influenza viruses, and that could result in a influenza virus that is transmissible between humans. And that would be something totally new, and that might be the starting point of a pandemic. That's why we worry, and that's why we report about this. Mm-hmm. Melvin, I'm roughly right?
That's right. That's right.
Interesting. You have a second story on ivermectin and metformin. What is the story?
Yes. So Researchers from the University of Minnesota in the US published evidence that the common diabetes drug, metformin, is able to decrease the amount of SARS-CoV-2 in the body and helps reduce the risk of rebound symptoms if given early in the course of a non-severe illness. And they tested metformin against a placebo in almost 1,000 adults infected with COVID-19. And it's good to also point out that more than half of those in the study were vaccinated, and the treatment took place when the Omicron variant was the most dominant version of the virus in the US. And I think it's really good to see that in this study, we have now metformin as a drug that is working in non-severe illness. And this study also showed that ivermectin does not work, which we know.
Yeah. Look, reuse of drugs in a desperate situation when you have no treatment is something you can try. But now using a worm medication, anti-worm medication used in horses and cattle to treat COVID is inappropriate, right? So this is a funny story that people still think this may be beneficial. I don't know why they do this. I guess it has to do with some fake news that were out there, and that now there is a lot of proof that it doesn't work. This is not the only study I did.
You know, we have already seen lots of studies with ivermectin, and the studies really show that it's not working. And I understand that during the early part of the pandemic, we all wanted something to work, right? And
Right.
I mean, I wanted it to work, but it didn't work, right? So I think the attitude should be we should be open to possibilities, but when we see data showing that it's not working, we should stop wasting time, right?
And dealing with side effects and negative effects besides paying the cost for a drug that doesn't work.
Exactly.
Melvin, you have something very exciting here, and it is about cobra snake bites.
Yes. Scientists from the Liverpool School of Tropical Medicine have discovered that the drug varispladib prevents tissue damage caused by African spitting cobra venom. And Professor Nicholas Casewell and colleagues in the School of Tropical Medicine discovered that using repurposed small molecule drugs like this specific one, varispladib, can block one of the two major dermonecrosis causing toxins in the cobra bite. And basically it stops the damage from the bite, right? Because when you're bitten by the cobra, you have damage in the skin and the muscle and whatever tissue that's being bitten, right? Or was bitten by the snake. And this is important because each year it is estimated that snake bites cause long-term effects in around 400,000 people around the world, with a substantial portion of those people in Africa. And the result, and because of this, it's important to note that this is a very good innovation, new development, because at the moment there is no effective treatment for severe local envenoming caused by spitting cobra in most countries, actually everywhere, right? And so this is good news, but again, like most innovation, I think the problem here would be access, right? Access to these important small molecule drugs.
Yeah. So that is really interesting and exciting. But I shouldn't say but. What we need to do now is to find out how to allow access to this in the regions that are involved. We don't need it in Germany, where you could have it in each pharmacy around the corner, but we don't need it here, right? Maybe you should just store it at the zoos in Germany where they have cobras, but other than that, it makes no sense. And in Africa, it is just people are scattered all over the country. There are few centers and long travel, long journeys to the centers for appropriate treatment. So let's see how this evolves as a treatment in the future. Yeah, but it's a great achievement. Yeah, congratulations to the team in Liverpool. Yeah.
Yeah.
Melvin, I have again and again we talked about the effectiveness and efficacy of anti-COVID vaccines. This is a very nice study that has big tables and large numbers to show the efficacy of mRNA vaccines against COVID. What it boils down to is this illustrative schematic documentation to get the concept. And I really recommend everybody to look at the original data in the paper, which is down here at the bottom of the slide. The story is severe disease, here in the red lines, the green line and the blue line. Severe disease is prevented by mRNA vaccination against COVID with above 90% for 12 months and longer. Whereas asymptomatic infection and symptomatic mild infection, there the efficacy is reduced over time, and down at 12 months, it is close to 0 or 10%. At 9 months, I would say it's 20. And 6 months, if you look here, it is 30 to 40%. So the endpoint for effectiveness is the important thing to look at. And particularly if you are older or if you have a risk factor, consider the one and only thing for COVID is you don't want to die. COVID infection is asymptomatic or with little symptoms if you are young and if you don't have any underlying disease. But again, if you belong to a risk group due to treatment, due to underlying diseases or age, get your vaccine and make sure that you get it regularly to get you above the 90% threshold for severe, critical, and fatal infection. COVID, Melvin, we said that again and again, but maybe you have a different view or another aspect that I forgot to mention here.
Well, I think we have now seen that these vaccines are working. We now have like 3 years, more than 3 years of data. And again, it's like the ivermectin story, right? The people who believe in ivermectin are the same people who don't believe in vaccines. And it's just showing us that data does not really convince people, right? It's their beliefs, whatever they believe in.
Yeah, we have to fight beliefs and replace them with data, right? Yeah, that is a 300-year-old concept. Look at the data, right? Kant, we just celebrated his birthday here in Germany. But many people don't even know this philosopher, and you really have to look at evidence. That is the baseline. What we try to do in our weekly podcast. And Melvin, I have here another story from Singapore, fighting dengue with a bacterium. So what they did in this large study, they infected male Aedes mosquitoes with a bacterial species called Wolbachia. And as a result of the infection, male Aedes mosquitoes were no longer able to fertilize effectively female Aedes aegypti mosquitoes, which in the end means there were less mosquitoes around that could transmit dengue virus. So this is a very nice study, and I don't go into the details of the abstract that you see here, but again, as the paper shows nicely, is there is a 77% intervention efficacy, although the coverage was incomplete across all towns. And overall, in the period that they did the study, more than 2,000 cases per 100,000 people were prevented. And as a benchmark, I always use that for vaccine intervention. You say that you want to have an effect, or you need 100 patients per 100,000. And here we see prevention of 2,000 per 100,000, which is 20 times higher. So this is really a very nice public health intervention, and that is something people should start looking into. And again, long-term data are needed, but it is a very nice paper for anyone to read. And the bibliography is again on the bottom of the slide. Any thoughts from your side, Melvin?
Yeah, so I think this is really interesting, and we know that at the moment, all potential tools that you can use for dengue should be used, right? Because there is no one perfect tool that can be used for this disease. My question would be, how often do you do this, and how costly is this going to be, right? So I think this is how we look at public health interventions, right?
Yeah, it looks like a simple measure, but it is probably more complicated. On the other side, if you use it frequently, then it may be cheaper and it may be even more effective. And people do all types of things to prevent dengue, right? They go through the city and spot each little reservoir of water down in the street or in wheels of cars or wherever. So this all costs money, and maybe this looks very effective to me. I think this is very nice.
No, because the reason why I say that is because in Singapore they do that all the time, right? They fumigate, they clean all these stagnant water, but still dengue is there, right? So it means that all these other things that you do, they're not actually stopping dengue. So it means that you need another public health intervention, right?
Yeah. Look, the dengue virus is certainly, I mean, humans are the main reservoir in the cities, right? So that is one point to see. But at the same time, there may be reservoirs outside humans in the jungle around the big cities, like in Ho Chi Minh City or in other cities, in big cities around the world that are affected by dengue. You lived in Singapore for a while and you worked there.
Yes.
Did you ever have dengue?
No. No.
Okay.
In the Philippines, I had, not in
Oh,
Singapore.
okay. Okay. So you had it once or twice?
I'm not sure, but more than once for sure.
Yeah. Anyway, it is better to not get it, I guess, right? Melvin, I have another nice story from a great paper that you see down here in the bottom of the slide, and that is on the benefits of vaccination with regard to preventing deaths. And the story begins with that vaccine uptake globally has been increasing since the late 1970s. And what you see here in the different colors are the different vaccines. And the one relevant one that I'm always looking at is measles first dose, and this here is measles second dose. So I think if this is measles second dose, if I'm correct, I cannot distinguish the blue colors here on the slide. I would say this is now approaching 70, 80%. And this is very important, as I will show you in the next slide. The one thing that I am not happy with in this paper, written by great experts, Haemophilus influenza type B is written with a capital B. And as all my students know, the capsular types of Haemophilus influenza A, B, C, D, E, and F, they are written with a small b, non-capsulized. But anyway, it is a great paper, and that is the only error that I spotted. And it is not about the content, it's a formality. But anyway, look here. What you see in orange, this is the number of deaths prevented through measles vaccination. And you see, of all vaccines, this is more than 50%. And the total number is 150 million deaths prevented over a 50-year period. And if you look at life years gained in that period, again, measles gives you the best effect, 9 billion life years gained. And finally, if you look at years of full health gained, which means you don't die and you don't suffer from a severe complication of measles, then you see this is 10.2 billion. So measles is really the one and outstanding vaccines, and it is a shame it is not eliminated and eradicated in many countries and regions. But again, what you can see is the other vaccines listed here in different colors, they contribute, but the one major effect comes from measles vaccination. Great paper to read. I cannot give all the data. I just wanted to show you the highlights. Download it from the reference that I show you here on the slide. Melvin, any thoughts?
Yes, so this is a very good paper published in the Lancet, and it's really showing the value of vaccines. And I think again, the problem is the messaging, how the key messages should be out there, right, for people to understand. Because if you look at this really long publication, I think many people who are not trained in science or medicine, or the health sciences, they would find it difficult to understand. But bottom line, it's really showing us that vaccination has saved lots of lives, and I think that's important.
Yeah. And this is the mission of the Bill and Melinda Gates Foundation and of Gavi and UNICEF, WHO. The best way to serve the health of nations and the individual alike is vaccination. Per $1 invested, you get the best and the most of a benefit. So this is why they're into vaccination. And I think this is very nice data to support this. Melvin, I think we're at the end of our Global Healthcast today. Melvin showed you that cows could be the relevant mixing vessels for different types of influenza strains. And that may be of interest or of concern with regard to the H5N1 situation we have in the United States. No human-to-human transmission to this point, and we hope it stays like this. Then Melvin hopefully convinced you that ivermectin doesn't work against COVID, while metformin has some effect. We spoke about the first treatment effect for cobra snake bites. There is a drug developed from Liverpool. We showed you that COVID-19 vaccines can prevent severe disease with an efficacy of above 90% for 12 months, whereas asymptomatic and mild infections cannot be prevented by 12 months. The efficacy with that regard is down to 0 to 10%. We then showed you that Wolbachia can fight dengue as shown in Singapore. And finally, I showed you the effect of vaccination on global survival and the big effect that measles vaccination is. And much needs to be done yet. We need 95% vaccine uptake against measles with 2 doses. And that's not where we are yet. Melvin, any final comment on any of the topics?
Not specific of the topics, but again, it's going back to misinformation and disinformation that we are trying to address in our own little way here at the Global Healthcast. But I hope more people will be more discerning when they see information, especially online.
Yeah, I just thought about something because you said the belief of people or the gut feeling of people and the perception of people, that is important, and they don't think about the facts. And maybe I think it is a good advice if it comes to love, believe with your heart. But when it comes to your health, look at the facts. And with that, I say goodbye to you, and hopefully we will see you again next week. Bye-bye.
Thank you, everyone. Stay safe.